Hey, what we're talking about today is using the CrossOver Symmetry, one of the best things that I've seen for shoulder rehab. Just a real quick cap, down and dirty on what we look for with good shoulder function. So number one is you need to have good mobility. And that means overhead range of motion. It means bringing the arm across. You should be able to put your hand on the opposite shoulder, raise the elbow up like this without any kind of impingement. Impingement is a real common problem in the shoulder that we see. It basically is a result of scar tissue that forms where the tissues, the joint capsule, the muscles, they get glued down from repetitive motion from overuse, and that starts to affect the way the ball and socket roll and glide. In order to have full range of motion in the shoulder, rotating, external and internal rotation, coming up in a full overhead position, what we call abduction, you should be able to easily get your biceps to your ear. The shoulder needs to be able to not only roll, but also slide. And so the very first thing we look at with shoulders, we've got to have mobility. We've got other videos that cover that. Secondly, we need stability. And rounding all that out, we need to have good motor control. What the CrossOver Symmetry is going to allow us to do is to generate some of that postural stability type strength. And we're going to go over about 7 or 8 movements today. Shoot to do between 6, 8, or 10 reps with these, and I would aim to do them 4 or 5 days a week minimum, just to round out your shoulder rehab program. So getting right into it. 2 different positions we're going to use is we're going to go at eye level on the straps or at knee level. You see me switch those up when we move. So just right off the bat here, we're going to do a face pull. So I can either go thumbs down grip, or I can also be kind of hands neutral here. Again, 6, 8, 10 reps. Moving right into a reverse fly, straight back. Followed by just a pull down. The key here is I want to extend past my hips. You'll notice I'm in a pretty athletic stance here. My hips can be back slightly. That just gives me enough of a forward body position to be able to kind of grab on here. I want a little tension on the band, straight back, and then I'm gonna just punch my hands towards the floor. That's gonna get right in through the middle shoulder blade area. That's a difficult move for a lot of people when they first start out. So just work on bringing the arms back, getting past the hips. This is basically a straight arm pull down. So here, down. Also want to be cognizant of head position, keeping the chin pulled in, tongue on the roof of the mouth. Here, back, and down. Another thing we can work on is just a simple rowing straight back, one arm at a time. About knee level. Again, we're going to make sure the bands are crossed. And first one we're going to do is just a straight out incline press. And what I like to tell people is imagine you're trying to reach around a tree. I'm not just simply punching out, I'm actually reaching out around, trying to pull my shoulder blade flat against my rib cage as I do that. You should feel it underneath in here. This is where the serratus sits, those finger muscles. The serratus comes in and attaches underneath the shoulder blade. That's what holds it flat against the rib cage. Giving you good stability and posture. Straight out. Again, don't let the chin get out of a bad position here. Okay. Next thing we're going to do is just straight up, what we call scaption. It's just basically thumbs up, straight up. Pretty easy. Okay, from here I can work into just alternating. Again, and that's working that serratus push. This is straight up. 90. Now, impingement in the back of the shoulder and up on top is really common. So a lot of people that are having impingement syndrome might not be able to tolerate this early on in their rehab due to pain. Basically, with all these exercises, a little bit of discomfort is okay. Pain is a no-go. There you have it, guys. CrossOver Symmetry. Look them up online at gocrossover.com.